Hello, good afternoon to everyone. Welcome back to our Facebook Live session. Today is the third Facebook Live session that SNCI have. And today we are very proud to have Dr. Angel Kwan Koni, our consultant clinical oncologist, to be with us and sharing about more insightful information regarding cancer. So the topic that Dr. Angel will be sharing with us is Know Your Enemy and Win the War. So without wasting any time, let's welcome Dr. Angel to share the topic.
Hi, good afternoon, everyone. So I am a clinical oncologist. Maybe a lot of people may be in doubt what clinical oncologists do. So in another name, I also call a cancer specialist. Okay, so I assist patients to fight with cancer. So when we fight with cancer, when we are going for a war, it's very important for us to know who is our enemy. So quoted from Sun Tzu, if you know the enemy yourself, your victory will not stand in doubt. So this is my content today, which I'm going to go through it in a while. So first of all, what is cancer? So cancer cell is actually originate from our normal cell in the body. So what's the normal cell do? As shown from this slide, when our normal cell in the body had the DNA damage, so it can go through two pathways. Either it can be repaired, and after it being repaired, it will return back to a normal cell. If the DNA damage is too much and the repair is impossible, so the normal cell will go through apoptosis, means the entire cell will die off and eventually being eliminated from our body. So what is cancer cell? So cancer cell means when the normal cell had an abnormal growth, loss of the normal growth function. So as seen from here, when the normal cell had the DNA damage, the cell didn't get repaired and the cell didn't get die off. Eventually, it go on multiple time of mutation and eventually it go through uncontrolled growth and it turned into a malignant cell. And what happened to this malignant cell? It also increase and stimulate the new vessels formation surrounding the malignant cell so that it can provide more nutrients to the cells to make it grow bigger and bigger and bigger. So the cancer cell also penetrate the membrane of the blood vessels and get into our blood circulation and eventually by using the circulation, it actually travel to other part of the body, especially when it trapped in the small vessel in others organ. And it caused the metastatic disease to the lung, brain, or liver. So what are the types of cancer we have? So we actually can divide the type of cancer by the cell types. So the commonest cell type is carcinoma type, which is actually begin in the tissue that actually line the internal organ. And there are another cell type, which is sarcoma cell type. It's actually started in bone, muscle, cartilage, fibrous tissue, or fat. And these two malignancy is under my territory. And there are other cell types like leukemia, lymphoma, and myeloma. This is under the territory of hematologists. So there are other type of the cancer also. It divided by the primary, means the origin of the cancer cell, like lung, gastric, brain, breast, kidney, pancreatic, prostate, leukemia, liver, colorectal, cervical, uterine, ovarian, skin, and bladder cancer. So what is the important about the cancer? And first of all, we should know what is the statistic, why we are so concerned about knowing cancer. Based on the global cancer figures. So this is the distributions of the new cases and death for the 10 most common cancer in year 2022. You can see from here, there are up to 20 million of new cases being diagnosed in year 2022 globally. And the top three being lung cancer, followed by breast and colorectal. And you can see from here, this is the mortality rate. So lung cancer being the leading cause of death worldwide. How about Malaysia? So this is the National Cancer Registry for year 2017 to 2021, reported the 10 most common cancer in Malaysia. It starts with breast cancer as a top one of malignancy, followed by colorectal, lung, lymphoma, liver, prostate, leukemia, nasopharynx, which is a type of head and neck cancer, gynae malignancy, prostate cancer, and ovarian cancer. This is the incidence rate in a specific age group for male and female. You can see from here, in comparison in 2012 to 2016, in 2017 to 2021, the case of cancers, they actually increased dramatically for male and female. And the 10 most common cancer is also slightly different by gender. For male, it's actually started with the top one of colorectal malignancy, followed by lung, prostate, and liver. For female, the top one being breast cancer, followed by colorectal, lung, and gynae malignancy. This is a graph showing the age-specific incidence rate for all the cancer. So from this x-axis, this is the age group. And this y-axis is the number of cases that being detected. We can see the cases of malignancy, it actually started to rise at the middle age of 20. Subsequently, it's actually increased exponentially by the advancement of the age. And what is the lifetime risk for us to develop cancer? It's a bit different for male and female, and as well different ethnic group. From here, we can see the lifetime risk to develop cancer is 1 in 9 in Indian male, 1 in 6 in Chinese, and 1 in 11 in Malay male. While for female, it is 1 in 7 in Indian and Chinese female, and 1 in 9 for Malay female. Cancer actually divided into 5 stages. It started with stage 0, which is carcinoma in situ. Means the malignant cell is stay within the cell and it didn't come out from the cell membrane. Followed by stage 1. Stage 1 is the early stage. It's also called a localized state. Means a small invasive tumor just at the origin of the tumor, origin of the organ. Stage 2 is localized, early localized advanced disease, when the cancer cell already started to affect the nearby tissue, and some may actually spread to nearby lymph nodes. For stage 3, it already went to regional, means the cancer already started to affect more surrounding tissue and spread to more regional lymph nodes. And for stage 0 to stage 3, all this is curable if we detect early and undergo a proper treatment. For stage 4 means the cancer has spread to other parts of the body, and this is metastatic disease. Unfortunately, at this stage, patients is not curative anymore. The treatment intention is mainly for disease control. Thus, early diagnosis and early treatment is mandatory because early cancer can be cured. So since with the advancement of the technology and we can get a lot of knowledge from online, why they are still having some delay in the diagnosis of cancer? So you can see from here, this is the journey that actually shown from the first presentation from the patient until the diagnosis of the cancer. So from the patient, so after the first symptoms patient having, so patients may go to primary care doctor to get some advice. So when the symptoms is not very serious, the primary care doctor may actually offer some medication unless with a repetitive visit to the primary care doctor that raise the suspicions of malignancy, then the primary care doctor might initiate some investigation like blood tests, tumor markers, or some ultrasound. Then after that, only refer the patients to the hospital. So from the referral to the hospital, patient will get the appointment. After seen by the specialist in the hospital, only started the further imaging, biopsy, or surgery, then subsequently only refer to oncologist to initiate the treatment. So the main delay is actually from the system, which it can improve more. And what we wanted to do today is to increase the awareness for the patients and for the public to avoid the delay from the patients by knowing more regarding the signs and symptoms of the disease, and as well when supposed to do the screening to detect the early malignancy. And why there is a delay from the patients is mainly because of the attitude. So because sometimes the symptoms may be not very severe, maybe it's just a minor symptoms. So we don't think the patients might not think this is very important. Then that's why it delay in getting an appointment to seek the medical treatment. So certain patients might think, yeah, I am having a mass in the body, likely this is malignancy. But they are too fear to know about the diagnosis. And certain patients may feel embarrassed and shy about taking some tests, especially when they wanted to examine the breast by doctors or they needed to do scopes by putting the scopes inside the motions place. So they feel embarrassed. And mainly it's the patient's psychology issue. That's why it actually makes the delay from the patient side. So what is the sign and symptom? Mainly I'm sharing the sign and symptom for the top 3 cancer and the screening. So the difference, I wanted to emphasize the difference of this. When you started to have sign and symptoms, it means you have to get the medical attention immediately. Screening is for asymptomatic patient, means the patient doesn't have any sign and symptom to detect the early cancer. So what is the sign and symptoms for breast cancer? So you might observe there's any lump or bump on the breast, at the armpit area or at the chest, or any wound at the breast that it didn't get healed and eventually growing in size, or some changes over the skin, like some redness or some thickened skin or puckering that actually appeared on the breast. Or at the nipple. So suddenly you get an inverted or sunken nipple. So this certain patient may have a normal inverted sunken nipple at born. This is normal if born with inverted nipple. But if you are not born with inverted nipple and sudden onset of inverted or sunken nipple, then you should get medical attention. Or any changes of the breast shape or size, or some discharge coming out from the nipple. This you should get the medical attention. So how are we going to check yourself? This is very important for breast self-examinations and it is advisable for all the female, okay? You should check your breast at least once per month, once in a month. If you have menses, if you're still having menses, so you check your breast about a week to 10 days after your period started. And if you already menopause, you can do any of the date that you like. Okay, so you stand in front of the mirror to look for any changes on the breast, a skin, or the nipple. Then there are few maneuvers you can do to look at any asymmetry of the breast by raise your arm up, then subsequently put both your hands on your hip bone to see the symmetry of the breast. If it looks asymmetry, then you should get the medical attention. Then it followed by checking the nipple. Then you should gently squeeze the nipple to make sure there is no discharge coming out from the nipple. Then started to be examine the breast. You can start from left going to right or right going to left. If you are going to check the left breast, raise your left arm up and then put your right palm on your breast, and you can press on it by a circular manner to feel for the entire breast. Then after you finish, then you should do it on another breast. After you finish both the breasts, you also can actually lie down on the back and put a pillow under the shoulder and repeat the same thing by palpating the breast. So that is to detect any mass on the breast. If you have any mass being detected, get the medical treatment. So how about the screening? This is for those that actually doesn't have any breast lump being palpated, and when we shall screen. So for the patients that actually age, for all the female that actually age 40 and above, you should start to have a baseline mammogram. And it is advisable to do it every year. And if you have strong family history of breast cancer or malignancy, it is advisable to do it earlier age. Certain people may say, I don't want mammogram because it is very painful. So it is not that painful. You might feel some pressure from both the plate from the mammogram, and the discomfort feeling will only last for a few seconds. And the entire process is only last for 10 to 15 minutes, and it has a very low radiation risk, and it wouldn't cause any harm. But if you are pregnant, you shouldn't proceed with the mammogram. Okay, if not, it is advisable for all the female to start the screening at the age of 40 or earlier if you have very strong family history. So this is a shown of how the mammogram look like and how they actually compress on the breast. So screening of mammogram is for early breast cancer, which I stated here, when it is not yet being palpable, means you can't even feel it. Because early breast cancer, it will start with microcalcification in the mammogram rather than a mass. So now we follow by the top two of the cancer, colon cancer. So what is the sign and symptom that actually can happen? Most of the patients, they actually have the changes in the bowel habit, like persistent diarrhea or constipated, or the caliber of the stool is reduced. Half of the patients might have some bloods in the stool when they pass motion, and about 10% of patients may feel a bit weak, which is due to the bloods in the stool, and they are losing bloods, means anemia, losing the red cell in the bloods. Then make the patients feel a bit weak. And only 3% started to have some cramping or abdominal pain. So that is when you have that kind of symptom, then you should get the medical attention. Okay, but if you don't have any symptoms, when we shall screen for colon cancer? So this is from the CBG Management of Colorectal Cancer Guideline. So it divided into different category. It depends on your risk. Either you are average risk or moderate or high risk. So if you don't have any family history, at the age of 50, you should start the screening. So if you have moderate or high risk, then it is actually advisable for the screening at 40 years old, or 10 years younger than the affected relative. What this means? Means if you have any relative, it diagnosed to have cancer at the age of 30. So you should screen 10 years before the 30, means at age of 20. And how to screen? So there is the flow chart here showing if you are average age, means you don't have any family history. So then we actually can do a stool checking. So by performing the IFOT, if this IFOBT is negative, you can repeat this yearly. But if it is positive, then you shall go for colonoscopy. But if you are moderate risk or high risk, you shall have the colonoscopy being done. This is a summary stated that if you are average risk, then you should screen at least 50 and above. But if you are worried, you can even start the screening at the age of 45. And if you had family history, then you should start 40 years or 10 years before the youngest relative at the time of diagnosis. And what is the screening options that we have? Just now we did mention that we do the stool checking. So this actually shown by do the stool checking. So it had only about 65% of the cancer detection rate. And the golden screening tool will be the colonoscopy because it had 99% of cancer detection rate and even 95% of the polyps detection rates. So just to share about this importance of the polyps detection, because for most of the colon cancer, it actually started with a small polyps in the bowel. So eventually, when the polyps go through multiple mutation and it started to grow and grow into a cancer cell, which takes about 5 to 10 years. If we can detect the polyps earlier and being removed by the colonoscopy, so we can actually further reduce the risk of getting colon cancer. So how about the lung cancer? Lung cancer patients might present with the symptoms like chronic cough. They might cough off some blood or some wheezing sound they're created. Or certain patients might have some pain over the chest or some bone. All patients have recurrent chest infection, recurrent infection in the lung. Or they have difficulty in swallowing or hoarseness of voice. This is because the food pipe is just behind our windpipe. So when there is growth in the lung or nearby the windpipe, then it actually can compress on our food pipe and cause us to have difficulty in swallowing. And certain patients may have feel breathless when you walk for a short distance, then you feel breathless. Okay, or unexplained weight loss and nail clubbing. So what is nail clubbing? So this is a show of the normal nail, which you have an angle at the nail bed. So for clubbing means you already lost of the nail bed angle. And this is a photo showing like a clubbing nail. So what is so important about knowing the cancer, lung cancer especially, and knowing about the screening? Because lung cancer is the cancer that most of the time detect at stage 4. And you can see from this chart, 80% of patients actually presented at stage 4, which is not curative disease. So we wanted to have a screening tool which actually can detect the patient early at the stage 1 to 3 so that patients can cure from the lung cancer. So what is the screening tool that we have? We have a low dose CT thorax. And when and which patients are actually eligible for all this lung cancer screening? So if you are at the age of 50, and you have smoking history, either you are active smoker or you have quit in the past 15 years. And if you already counted your smoking history, then you have reached more or equal than 20 pack years, then you should go for this screening. And how are we going to count these pack years? So it's the number of packs of cigarette that you smoke every day times the years that you have smoked. If you smoke 2 packs per day, then if you had been smoked for 10 years, you are reaching 20 pack years. So this is a low dose CT thorax, which actually can screen those lung disease, lung cancer that is sitting quietly in our lung to make the early diagnosis and early treatment possible. So what is the risk factor for cancer? So you can see from here, there are many risk factors for cancer. There are something that we can't change, which is something intrinsic, something that actually inherited. And there are something that is extrinsic, which is something that we can modify by reducing the risk of getting cancer. Since just now I mentioned regarding intrinsic risk that is not possible to change, that come with questions. Is inherited cancer, can it be prevented? Because this is inherited. Not worry, because hereditary cancer is only 10% throughout the cancer. So most of the cancer, more than 90% is not hereditary. Okay, it's actually because by our exposure. So if you have family history of cancer, it doesn't mean you are 100% getting malignancy. By modifying your lifestyle and reducing the risk, reducing the genetic, reducing the environment or lifestyles that actually can cause you to have cancer, can reduce the risk for you getting cancer despite you are inherited. So what is the things that actually can increase the cancer risk? This is from the research, which smoking is the top one that actually increase the cancer, followed by obesity, alcohol consumption, UV radiation exposure. This UV radiation exposure is an excessive UV exposure. It's not saying like because we are living in Malaysia, so we don't go under the sun. So not really that. It's an excessive, too much of UV exposure. Okay. Poor diet, which is a lot of fat, processed food, pathogenic infection, something like HPV or hepatitis B virus, which can increase risk of cancer, or being physical inactive. So what is the way to reduce the cancer? By avoiding what I mentioned just now, maintaining a good healthy weight, don't get the obesity, physically active, high fibers diet. If you are a female and after delivery, breastfeeding is recommended because it actually can reduce the risk of developing breast cancer. Limit the consumption of fast food, limit the intake of the red meat. Red meat is like beef, pork, or lamb. Okay, reduce or avoid those processed meat like hot dog, bacon. Limit or reduce alcohol drinks. And the last most is limit the intake of sugar or sweetened drinks. So if I show this, for sure, I think I'm going to get more questions because there is a myth means saying, is the sugar increased risk of cancer recurrent? Because I mentioned here, you should reduce the intake of sugar. Okay. So from the research up to the recent research, there is no proven data saying like sugar can cause the cancer recurrent or sugar can cause you to have cancer. But because excessive intake of sugar will increase risk for you to get obesity. And obesity is a risk for you to develop cancer. So you can take moderate of sugar and keep yourself active to keep you in a healthy weight to reduce the risk of developing cancer. Okay, so beside the topical just now that I shown, being a second-hand smoker also there is a risk. Okay, so beside that, vaccination, because just now I did mention some pathogenic like hepatitis B or HPV can actually increase risk of cancer. So then we can consider getting a vaccination. And most importantly is screening, screening, and screening before you have the sign and symptom. Okay, so eat healthy and prevent cancer by eating more whole grain cereal, the wholemeal food, beans, veggies, and fruits, and avoiding all this above. Last but not least, many cancers are curable and controllable if we detect early and we treat appropriately. Even unfortunately, you actually detected a stage 4 cancer, not to worry because more treatment options is actually available now. So you can have the combinations treatments like a hormone treatment, surgery, chemo, targeted treatment, radiation treatment, immunotherapy, or some local therapy by using intervention or radionuclide treatment. Cancer is not a death sentence, but rather is a life sentence. It pushes one to live. So we have some cancer screening guide, which you can available getting online by Google all these things. Every battle is won before it is fought. Don't fight cancer alone. If you never give up and you are a fighter, and we are always ready there with you and to help you win the war. That's all from me. Thank you. So if you have any questions, you can type it and I can try to answer whenever, if I can answer. Yes, so I have some questions. Okay, so the first question, as women are suggested to undergo mammogram after 40 years old, do we need to undergo it every year? And when should we stop undergo the mammogram? Okay, let me share. Let me go back to the screen for the breast cancer. Okay, so it is stated here, it's actually recommend to do a mammogram every year up to the age of 55. After 55, you can do it every 2 years. You can do it every 2 years if there's no abnormalities detected. Okay, so then it comes with the second question. Are there, as there are few cancer treatment available, how does the doctor decide when to use chemotherapy, radiotherapy, or surgery? So the most important thing is we need to see the patients, because now we are moving to modern treatment, personalized treatment. So we need to see the patient's body condition and knowing the patient's comorbidities like the diabetes, blood pressure, or any heart disease. And we will plan ahead from there. It's not saying like all the patients will receive the same treatment. It is depends on the patient's body and which treatments that actually suit the patient by giving the best treatment to kill the cancer most and getting the less side effect for the patient. Okay, so the third question is, if a child is affected by cancer, will the treatment the child is similar to the adult? Okay, so I'm an adult oncologist, so I treat adult malignancy. Child's malignancy is actually under PITS oncology. So the child cancer is a bit different compared to adult, and the treatment is totally different. So if you do have child that unfortunately detect to have cancer, you can get advice from the pediatric oncologist. Okay, I think that's all the questions. Thank you so much, everyone, for listening.
Right. So thank you, Dr. Angel, for sharing us this insightful information regarding cancer. And I think this sharing today to help us to get know more about cancer and how we should do to prevent it and better with it. So thank you, Dr. Angel. And for our public, if you have any further question to ask or you want to make an appointment with our doctors, you can feel free to call to the general line of our Doctors Angel Clinic direct line at 05871 and or visit our doctor at SMCI level 2 room 25. Thank you.